everyone. My name is Jennifer Song, and I was born in Ithaca, New York, but currently I live in Seoul, South Korea. I attend Dwight School Seoul. Today, I will be giving my presentation on the topic of malnutrition. Before we get into the actual presentation, here are a few things about me. I'm a rising sophomore who lives in Seoul, South Korea. I play volleyball, both for my school and a club team. Along with two of my other friends, I am a founder of Code Miracle, a nonprofit humanitarian aid organization. And finally, I hope to pursue a career in nutritional sciences and take the pre-med track. So let's start off with this question. Why is malnutrition a global issue? First off, malnutrition is a big contributing factor to mortality rates. When pregnant women and breastfeeding women become malnourished, their unborn children and infants cannot develop normally. Children who lack diverse diets suffer from weakness, stunted growth, illness, and even death. In social aspects, poverty amplifies the risk of malnutrition. People who are poor are more likely to be affected by different forms of malnutrition. Also, malnutrition increases healthcare costs, reduces productivity, and slows economic growth, which can perpetuate a cycle of poverty and ill health. Here are the table of contents for the presentation today. Malnutrition in our world and how it affects us. This is a summary of the statistics from World Vision, an international humanitarian aid organization. Malnutrition impacts 1 in 3 people globally. 45% of all deaths in children is attributed to poor nutrition, and 462 million of the world's adults are underweight, whereas nearly 2 billion people are overweight. In recent days, the COVID-19 pandemic has been quite responsible for the increased risk of malnutrition. This is because of how the guidelines set of social distancing, full/partial lockdown, and how quarantine affects the economy. A number of households have suffered loss of income, thus their sources of supplemental food, for example, school lunches, have been limited. Furthermore, studies have shown that there is an increase in incidence of malnutrition among older adults with COVID. This is a graph from the report, Long-Term Effects of Malnutrition on the Severity of COVID-19 by Alex Kurtz and Kenneth Grant from Albany Medical College. The graph displays the following. The odds of severe COVID-19 increase among malnourished adults with a history of malnutrition between the ages of 18 and 78 years are at higher values than their peers with no history of malnutrition. A crossover effect took at 79 years, wherein patients with no history of malnutrition had severe COVID-19 symptoms than their malnourished peers, although the risk of both groups continued to rise with age. Undernutrition and the different types of malnourishment. First, we have protein energy malnutrition, which results from a deficiency in any or all nutrients. The 3 types of this malnutrition are acute malnutrition, chronic malnutrition, and acute and chronic malnutrition, which is a combination of the two. Wasting and stunting. Stunting is chronic and it doesn't pose an immediate threat to life. Conversely, wasting is more serious as it is a result of an acute shortage of food. Wasting is the highest priority form of malnutrition in humanitarian emergencies. Finally, obesity is an excessive fat accumulation. It is also considered as a form of malnourishment because it is defined as a paradoxical state of malnutrition. Despite excessive energy consumption, obesity is typically associated with a shortage of individual microelements. Malnutrition can lead to a variety of detrimental diseases. Now, we will look into some mental and physical disorders caused by malnutrition. In Black, we have diseases that are caused by undernutrition. These include kwashiorkor, marasmus, and anemia. Kwashiorkor is a protein deficiency disease. Marasmus is caused by a lack of protein and calories in the diet. However, it is not caused by calorie deficiency alone. Marasmic children subsequently develop kwashiorkor. The two diseases share common symptoms of swelling in the body, hair loss, skin patches falling off, body fat depletion, and wasted muscles. Anemia is more common in females because it is a consequence of iron deficiency. Menstrual losses and increased needs in pregnancy are its symptoms. The most common diseases caused by obesity are in blue. They are type 2 diabetes and heart disease. Finally, a mental illness that is associated with malnutrition is an eating disorder. Eating disorders can come in many different forms, including anorexia nervosa, bulimia nervosa, binge eating disorder, pica, and avoidant restrictive food intake disorder. On the bright side, there have been many integrated approaches to solving malnutrition. Here are a few examples. Therapeutic feeding centers are hospital-like facilities that help children and their parents remain in residence during their month-long treatment of critical medical and nutritional care. Ready-to-use therapeutic foods with the acronym RUFs have been developed in the form of peanut butter-based pastes and biscuits. They are packed with high concentrations of protein and energy, and they reduce exposure to waterborne bacteria as they contain no water. Community outreach is a program designed by the organization Action Against Hunger. The AAH, Action Against Hunger, integrates the assessment, treatment, and prevention of acute malnutrition into the national, regional, and local healthcare systems. Hospital treatments of malnutrition include a person who is not able to gain weight being treated by therapeutic milk products. Malnutrition can happen with anybody at any moment, so let's discuss what you can do to prevent malnutrition. First, educating yourself and others with solid information about nutrition helps you build a fundamental understanding of eating healthy. Being aware of your diet and the diets of people around you will help identify if you are consuming all your essential nutrients or not. A well-balanced diet with a variety of nutritious whole foods will help you keep your body in good physical condition. If you feel that you are missing something or if something is wrong with your diet, a blood test at the hospital can help you find out if you are deficient in any of your nutrients. Here are my concluding thoughts on this presentation. The main purpose of this presentation was to inform and deliver how malnutrition is affecting the world on a global scale. The key takeaways are the following. Malnutrition is very common in people of all ages, and it can be a primary cause of detrimental illnesses. Undernourishment and obesity are both examples of malnutrition. And finally, being aware and well educated is the best method to prevent malnutrition. These are my references. I would like to give a big thank you to the coordinators of the Global Health Leaders Conference at Johns Hopkins for giving me this prestigious opportunity to present on such an important topic. Thank you to my parents for being supportive all throughout my life, and thank you for listening to my presentation. You can reach out to me via my email and Instagram. Once again, this is Jennifer Song from Dwight School Seoul. Thank you so much for listening.